Hi, my name is Dr. Buck Parker, and I'm a general and trauma surgeon. In this short video, we're going to talk about the colonoscopy. I know you're all very excited to get one, but we'll just talk about it first for a little bit. So we'll go over what they are, how they're performed, why they're recommended, and then who should receive a colonoscopy. First of all, a colonoscopy is basically a visual examination of the colon or the large bowel. But before the colonoscopy, the colon must be cleansed so the doctor can see every inch of the lining of the colon. So the day before the colonoscopy, you'll be asked to either drink liquids or just eat very lightly. In addition to this, you'll be giving some medication or a solution to drink to cleanse the colon. You can download a copy of our colon cleanse instructions on our website. Most people say that the colon cleanse is the worst part of the whole colonoscopy, but it's very important to follow these instructions closely, because if it's done improperly, then your doctor may ask you to repeat the colonoscopy and the colon cleanse, and usually one time is enough for everybody. The colonoscopy is done with a long, thin, flexible camera. The camera is able to be maneuvered through the colon by hand control. Now, this is done, of course, after you're sedated. During the colonoscopy, you're sedated such that you can breathe on your own and follow simple commands, but you won't remember the examination at all. The doctor will maneuver the camera through the colon while watching the projected image on the TV screen. The doctor advances the camera to the first portion of the colon, also called the cecum, which is located in the right side of the abdomen, and often into the last portion of the small bowel. The doctor then withdraws the camera slowly, inspecting the entire lining of the colon, rectum, and anal opening. The magnification the camera provides allows the doctor to inspect the lining of the colon for abnormalities. Most commonly, the doctor is looking for polyps. A polyp is a small protrusion of the lining of the colon, which can be benign or malignant in nature. The reason we are looking for polyps is that polyps may harbor small cancer cells. If these cancer cells are identified early enough, when they are very small and in the head of the polyp, removal using only the instruments during the colonoscopy is enough to prevent cancer from spreading to the rest of the body. If the cancer is identified when it has spread beyond the polyp, then a surgery with removal of a portion of the colon is required. In addition, the surgery is not a guarantee that the cancer has not spread to another portion of the body. So the colonoscopy can be the least invasive means of stopping the cancer in its tracks. In medicine, anytime we're doing a procedure, there are risks associated with that procedure. Major risks of colonoscopy are, first, perforation of the colon. If you should have a perforation of colon, which it doesn't happen often, but it does happen, you would require an operation to repair the colon. Secondly, is bleeding. It doesn't happen often either, but sometimes there is bleeding associated with the colonoscopy during or afterwards. Most of the time, this is self-limiting. Third is missed pathology, such as a polyp. Sometimes polyps are missed. And fourth is incompletion of a colonoscopy. Sometimes we're just not able to see the entire colon for various reasons, and that's also a risk. These are essentially the most common risks of a colonoscopy. So, who needs a colonoscopy? At the current time, colonoscopies are recommended to anyone over the age of 50 years young. Depending on the results, your doctor may ask you to repeat the colonoscopy every 3, 5, or 10 years in most cases. I hope you've gained some valuable information about colonoscopies in this video, and ultimately it serves to reduce your anxiety about the examination in general. It really is a useful examination everyone should have to reduce your risk as well as prevent colon cancer. Alright, I'll see you in the next video.